This is the forearm X-ray of AP and lateral view with the radial fracture, and we will go for the procedure now. This is incision over the forearm through the Henry approach. We'll put the plate and measure the length of the skin incision, and we'll also mark the fracture site. So after the incision, basically there is a veins, superficial veins, which either you have to coagulate or separate from the dissection. And always try to check the FCR tendon so that it will be over the tendon, because on the radial side there will be the radial artery. And after the dissections, we'll go to the facial planes. We will find lots of fat here sometime, because this is a female patient, so we will find the fat also. So now you can see the lots of fat, which actually I prefer to do the dissections with the artery to avoid too much bleeding, as I'm using the tourniquet, but sometimes there is a chances of post-operative hematoma, and which can lead to the compartment. So my preference would be always to do the blunt dissections instead of sharp dissections. So after the skin incision, the fat has been removed, and you can see the fascia over the flexors of the arms, and we will find the FCR tendon, and over that we'll make incision. So FCR tendon has been retracted laterally, and now I'm going to the deep dissection to release the pronator quadratus from the lateral aspect of the radius. So now this is the FCR tendon, and this is on the medial aspects. So now I'm going to retract the FCR tendon laterally. I have dissected the fascia also down, and after this retraction, then you can directly, after releasing the pronator quadratus, you can expose the fracture site. So now we have reduced the fracture with the bone holding, and we will put the plate of around 6 to 7 hole, and we'll put the screws. So we'll go for the 6 holes. So these are the fractures. We'll go for 3 hole up, and this is the fracture site. Perfect, huh? A little down.
Like when you check, let me check, sure. We check here 1, 2, 3. Okay.
After holding the plate and the fracture reduction, generally try to keep the 3 holes on the either side of the fracture, and then try to stabilize the plates with the K wire, and you are going to put the one cortical and one locking screws on either side. So now I am drilling the bone so that I can put the cortical screws first to go for the compression, and that will also align the fractures. This 6 screws plate, you can see this, and fracture is well aligned. And now I'll close the fascia and then skin. So now you'll see on the C-arm, you can see this fracture is, this is the AP, fracture is well aligned. Now we'll take the lateral beam. Lateral, please. Yes. Perfect. So this is the after closure, and we have to check the stability. This one looks fine.
Okay.
So thank you to watching this video. For more surgical videos, subscribe our channel.